Guyanese. The coronavirus disease 2019, known as COVID-19 pandemic, has had a devastating impact globally. Guyana confirmed its first imported case of COVID-19 in Georgetown on Wednesday, the 11th of March 2020. That patient, a 52-year-old Guyanese woman who had traveled from the United States of America to Guyana on the 5th of March, presented to the public health system on 10th March. She died at the Georgetown Public Hospital Corporation on 11th March. The total number of confirmed COVID-19 cases in Guyana has since increased to 8, inclusive of 1 death. Guyanese. Guyana responded quickly to the pandemic. I appointed Prime Minister Moses Nagamutu chairman of the National COVID-19 Task Force. The task force has drafted a national strategic master plan that will guide our approach to combating the novel coronavirus disease. On Monday, 16th March, I issued directions under the Public Health Ordinance and International Standard to prevent and control the spread of this disease. I authorized the Minister of Public Health to take all measures considered necessary to restrain, segregate, and isolate persons suffering from the disease and or who may be likely to be suffering from the disease. The public must adhere to infection prevention and control measures, as personal conduct is the single most important element in preventing the spread of this deadly disease. The Minister of Public Health, Honorable Valda Lawrence, established the Health Emergency Operations Center. I thank the Ministry and the Center for the work they have done to date in containing the spread of COVID-19. The Center has been conducting screening, testing, and quarantining, and, when necessary, isolating those who have been suspected of having contracted the virus or those who have come into contact with infected persons. The National Task Force continues to monitor the situation in Guyana, and this includes citizens' conduct. We are concerned that too many citizens and businesses have been ignoring public advisories and warnings. Guyanese, a cavalier approach in the face of this global pandemic can seriously impair our efforts to combat COVID-19. Consequences will be devastating for the entire population. Several additional measures aimed at limiting social contact are already in force. All schools have been closed until the 20th of April. The National Grade 6 Assessment Examination has been postponed and new dates will be announced. The University of Guyana's campuses have been closed. The Cherry Jagan and the Eugene F. Correa International Airports have suspended operations for 2 weeks, starting on the 18th of March. Travel to countries which border Guyana have been suspended. Seaports have been closed to international vessels, except merchant ships, from the 21st of March. Public servants have been placed on a rotational shift system of duty. The Guyana Revenue Authority has waived the value-added tax on medical supplies associated with the testing, prevention, and treatment of COVID-19. And the Guyana Police Force has augmented its deployment to deter persons from using the backtrack route to enter and leave East Berbice quarantine region. The Minister of Public Health has kept Cabinet and the public abreast of the progress of the National Anti-Coronavirus Campaign and will continue to do so. Guyanese, I urge you to continue to support all medical professionals, doctors, nurses, and other caregivers. I urge you also to practice social distancing in public places and to avoid crowds, ceremonies, including funerals and large gatherings. I urge also that persons remain calm and implement all guidelines relating to personal hygiene and infection prevention and control.